Okay, good afternoon. Thank you for coming. My name is Shahrul. Shami, right?
Yeah.
Okay, so I'll be your fitness professional for today. So we'll be going through a pre-participation screening to check if you're medically cleared to go through the exercise program, and also to see if we can progress the intensity of the exercise. Because we'll be doing this together, I'll be using the ACSM exercise pre-participation health screening questionnaire instead of the PAQ. Okay? So I'll be asking you a series of yes or no questions. So you just answer accordingly to your best knowledge. Is that okay? Okay, so for the first one, I'll check any symptoms. Have you ever experienced any chest discomfort with exertion?
No.
Okay. Have you ever experienced unreasonable breathlessness? Any dizziness, fainting, or blackouts?
No.
Any ankle swelling?
No.
Unpleasant awareness of a forceful, rapid, or irregular heart rate? Burning or cramping sensations in your lower leg when you are walking short distance? Okay, for your current activity, have you ever planned a structured physical activity for at least 30 minutes at a moderate intensity on at least 3 days per week within the last 3 months?
No.
Okay. Now check any medical for your. Now I will check your medical conditions. Do you currently have a heart attack? Heart surgery, cardiac, or any coronary diseases? Do you have a pacemaker or a implantable cardiac defibrillator?
No.
Okay. Any heart valve disease?
No.
Heart failure?
No.
Heart transplantation?
No.
Congenital heart disease? Diabetes? Renal diseases? Okay, so far everything is a no. Okay, now we're moving to the next step is to check your disease history. Okay, do you have any known cardiovascular, metabolic, or renal diseases? All no, Okay, so I will ask you for any signs and symptoms. You just answer yes or no. Yeah. Pain or discomfort in the chest, jaw, arms, or any areas due to myocardial ischemia?
No.
Okay. Shortness of breath at rest with mild exertion? Dizziness or syncope? Okay. Any fatigue or shortness of breath with usual activities? Okay. Ankle edema? Palpitations or tachycardia?
No.
Okay. Intermittent claudication? Heart murmur? Unusual fatigue or shortness of breath with usual activities? Okay. So far everything is a no, yeah, for your questionnaire. Okay, next step. I would need to check with you how hard you hope to exercise. So there's 3 intensity: low, moderate, and vigorous. You tell me which is the baseline you are okay to start with.
I think moderate. Then
Moderate.
casually go up to vigorous.
Oh, so if you're comfortable, we can gradually go up to vigorous. Okay, can. Okay, so now I'll be using the ACSM pre-participation screening algorithm. So because you fall under the category of do not participate in regular exercise, I will use that following algorithm. I will get back to you with the result in a minute. Okay, so after checking with the ACSM pre-participation screening algorithm for individuals who do not participate in regular exercise, I've already checked. Your result is you do not require any medical clearance. Okay, so based on this algorithm, it is recommended that we start the exercise program from light to moderate intensity. Okay, as you progress, if you're comfortable, then we can progress to a vigorous intensity. Is that okay? Okay, so now I'll be going through with you the informed consent process. So firstly, once you sign on this informed consent, uh, you will be needed to do 3 assessments: one postural assessment, one cardio respiratory fitness assessment, and one balance assessment. So the benefits of doing these 3 assessments is that we are able to design an exercise program that is specifically for you. Okay, so there are also risks, but at any time, if you are not comfortable with doing this exercise, you are free to withdraw at any time. Okay, so do you have any questions about the program? No, yeah. Okay, so there's 3 pages. You just read through. Once you're okay, on the last page, you just write your full name and your signature. Okay. Okay, yeah, here's the pen. Okay, just read through. Okay, if you understand, you just sign your name there. Okay, thank you. So I've obtained your informed consent, yeah. Okay, so now for the final part of the assessment, we'll be checking your resting heart rate and resting blood pressure. Since you've been comfortably sitting for about 5 minutes, I assume your heart rate is quite low, quite relaxed right now. Okay, so just place your arm on the table, then I'll record your resting heart rate. Okay, I'll get the timer. Okay, come. Okay. So just relax. Okay, I'll record down your resting heart rate. Alright. Okay, next I'll be checking for your blood pressure. So same thing, arms relax. Just put your hand in the cuff. Okay, so just relax, stay still, lean back, yeah? Try not to talk or move during the measurement. Okay, I'll record down your blood pressure measurement. I'll explain to you the results in a minute. So your resting heart rate is 71 beats per minute. So according to the normative data, it's around an average adult lah. Okay. Also for your resting blood pressure, your systolic reads at 115 and diastolic reading is at 75, which is a normal blood pressure reading. Okay.